We suffered from being ranked the highest, not only in the state of Alabama, but in the nation for opioid overdoses per capita. We were in the top 3, top 5, and at number 1, I think in 2023, for the most overdose death rates per capita.
Welcome to The Shield. As you know, if you listen to us regularly, and we hope you do, this is a place where we talk about the intersection of substance use and mental health amongst all assets of life. And at the same time, we really highlight some amazing things that are happening in the Birmingham metro area. This is brought to you by the Children's Trust Fund. We're so incredibly grateful for their support, and we could not do this podcast without them. I am really excited about our guest today. I've heard so much about her. We've never actually got to meet in person, and she's doing some pretty amazing things. So without further ado, joining me today is Paige Britton. She is the founder and executive director of the Recovery Den in Walker County. Yes. Welcome.
Thank you for having me. Super honored to be here.
So let's start from kind of the beginning. So talk to me about Walker County, because as somebody not from Alabama, moved here about 2 years ago, Walker County is unique and has its really unique strengths, but also some unique challenges.
Okay, so Walker County is a very rural community, and we
north of Birmingham, right?
Yes.
North of Jefferson.
Yes.
Okay.
We suffered from being ranked the highest, not only in the state of Alabama, but in the nation for opioid overdoses per capita.
Can you just say that one more time? Like, that is pretty mind-blowing.
Ranked one of the highest. We were in the top 3, top 5, and at number 1, I think in 2023, for the most overdose death rates per capita.
And per capita is significant because it is a rural county.
Yes.
So we're talking about a county that was hit very hard by overdose.
Yes. Yes, we were the highest for like opioid prescriptions, hospital visits, things like all the things, that data has been collected on. And now we are able to collect better data, but we had absolutely no resources in Walker County. We had one outpatient program, and we had a faith-based halfway house in Walker County, but other than that, you didn't have resources. So for someone like me in active addiction, you couldn't get services, resources. I didn't even know that resources existed. That do exist, especially for people without insurance, until, later into my recovery. So it was important for me to be a part of the change I wanted to see in my community.
Yeah.
And thankfully, I got the opportunity to be able to do that.
And so you're born and raised in Walker County?
For the most part,
yes.
For
the most part, yes. Okay.
I was born in Birmingham, but I lived in Winfield for a few years and then moved to Jasper. But my whole family's from Walker County, so.
Got it. And like industry there, are there mills? Are there? I mean, do you?
So it is known for the coal mines.
Oh, okay.
And we have some factories popping up, car factories.
Yeah.
Chicken plant,
Right.
things like that.
Okay.
But it's a lot of fast food restaurants and Walmart.
Jasper, I know, is really seeing some economic growth here recently, right?
Yes.
I mean,
yes.
And Walker County as a whole, I mean, to your point, there is now more resources than there were before. I know the Walker County Community Foundation has been huge in that, and there's been some other like major players.
Okay, so thankfully, I will always and forever be grateful for the Walker Area Community Foundation because, you know, they see a problem, they want to address it, and that's my heart.
Yeah.
So I got to be a part of what started out as a behavioral health consortium to help bring resources to Walker County.
Okay.
And it literally started with 5, maybe 8 of us in a room. And I was brought in. I wasn't one of the first ones in there by any means. But COVID hit, and where that was devastating, of course. But it was a blessing to Walker County because what we called the Behavioral Health Consortium wound up becoming the Healing Network, where it just started with very few of us in a room, and now there's over 69 partners, 140 people from those partners join meetings and collaborate. We've been able to bring resources. When I got sober and found out that there was a such thing as a certified recovery support specialist, and I could help people get into recovery, I started out working at Ross, which is the Recovery Organization Support Specialist, and was having to drive people from Walker County out of the county to get an assessment because the only place we had was one outpatient center, and it was impossible to get somebody in for an assessment within 48 hours. It was months.
And if you don't catch them in that window, you might lose the motivation. Right.
Yes.
And
we want to do it within
maintain
24 hours,
right.
but 48 at the max. Because then, if we say we want help and we don't get it, then we're like, we tried.
Yep, I
Or
tried.
And
I guess I must not be that bad.
Right.
Right, exactly.
Right.
And you talk yourself out of it. And so when you got into recovery, when was that?
March 31st of 2015.
Wow, congratulations.
Thank you.
So did you immediately become a CRSS?
No. You have to have 2 years.
2 years.
In recovery, but I was 3 years into my recovery. I didn't even know something like that existed.
It's hard for people to know it exists. And then, some people jump past all the qualifications and they're like, oh, I had no idea. I could have already done this. But other people, it's something to work towards, and other people don't even know it exists.
Right.
So you got your CRSS, you started working at Ross. Mm-hmm. And the one thing that I'll say about Walker County that I've been very struck by, and I grew up in a rural community in Missouri, and sometimes in rural communities, there is this feeling of, don't come in to my community and tell me what to do. Don't think that you're better than me. Don't think that you're, and I think a lot of that has to do with mistrust, because people will come in for a grant and then they'll leave, right? Yes. Or people will come in and they'll act a little snooty pooty, and then they leave, or they try to change the community without actually understanding the community.
Right.
But the thing that I'll say about Walker County in particular is that every single person that I have met is so open and interested and willing for resources, right? There's not you can't come in here. It's like a yes, and how, and when, and how can you get started?
Yes.
Like, how can we help you?
Yes.
Where do you think that comes from? Like, it's this desire to say, come on.
The Healing Network. I mean, a lot of work that went into that. A lot. Rachel Puckett, she used to be over that.
Okay.
And then the Community Foundation, the collaboration that they do with others, helping our community see that what we're doing is not working. We need more. And these resources are willing to come in and help. Let's welcome welcome them.
I mean, when we got
it's
some
working.
funding from the Walker Area Community Foundation to do a smart recovery meeting, it made sense for Randy to reach out to you. And he said, which, I mean, this is why my team is so great, because he was like, well, before we do anything, we better talk to Paige. And he said he could barely like get the ask out before you were like, yeah, let's go. When can you get started?
Yes.
So you're at Ross. So thank you for that. So you're at Ross. And at what point in time do you start thinking, hey, we could be doing something different here in Walker County? Because what you've created is amazing. So talk to us about that.
About a year into working at Ross, I wanted to see a community center, a recovery community center, come to Walker County. But
and pause. Tell folks who don't know, what does it mean to be a recovery community center?
it is a peer run. So peer run means us people who have the lived experience. We're all in recovery. We're all in long-term recovery. It's ran by peers, and we are there to basically help with not only starting your recovery, but continuing
Maintaining
your recovery.
it.
Yes.
Yep. Okay.
So we want to connect with resources, be a support in whatever area that we can be. So you get to come in the doors, and there's not a single bit of judgment or any kind of feeling of stigma, because we've all been in your shoes. You know, I mean, whether it was being unhoused, you know, whether it was losing your children, whatever, however bad you feel like your situation may be,
You've been there.
Yes. And we're all like a big family. We make people feel comfortable,
But not a dysfunctional family.
Right.
Like an actual functional family.
Yes, 100%. So,
So when did you create the Recovery Den?
in 2023.
Okay.
So I wanted to start something in 2021. I knew in my head that I, wanted to see something like that come to Walker County, but we didn't have enough people that were certified recovery support specialists. Right. We were, there was just 2 of us, and we were trying to get more people interested, but just because people are in long-term recovery doesn't mean that they want to work doing this kind of work.
Absolutely.
So more people started getting certified, and it just wasn't. Walker County was really a hard county, so outside resources didn't want to start.
And it wasn't because you all didn't want the help. What do you think prevented some of it?
Just the support from community, you know what I mean? Like the community leaders, things like that.
Yeah. Because there's a stigma.
Right.
Let's just be real. Right?
Yes.
Yes.
And
if we create this thing, it's sort of acknowledging that we have a problem.
Right. And, everybody feels, or not everybody, I'm not going to say everybody because that's not fair, but a lot of the people that have stigma issues is because they've seen people get sober and fail, or, they've seen people lose their life to substance use disorder. And we're here to show that it is possible to recover and be productive members of society.
That's
and
right.
We want to give back to the community that we took so much from, that we were such a menace to. And we at the Recovery Den make sure to do that. We want to make sure that we're giving back to our community, and also being and leading by example, because we can do it. And this is what recovery really looks like. We're better together, and when we all come together as a group, it just makes this it makes it unstoppable, of what we can make happen in our community. So we I wanted to see, and I wanted this in Walker County for a long time. And, we were able to bring Recovery Resource Center to Walker County.
Fab.
Yeah, yes, one of the best. And while they provide, walk-in assessments and peer support. We needed something more so to where you could walk in and be like connected with all services and just a little bit more,
Yeah. For sure.
a little bit more, because for a lot of people, they have no support system. And I want for them to know that they can walk in the door, and just because we've done an intake and you've had an assessment, you can sit and you can talk and,
you can hang out.
Yes.
You can take a deep breath.
Yes.
Right? Like
yes.
you can, it's, I don't want to put words in your mouth, but I mean, you called it a den. It's like a place to,
yes,
to not hide, but to just exhale.
Right.
Right? Where people get you.
Exactly.
Yeah.
And so I had been doing this work since 2018, and because of being a part of the Healing Network, and working at Ross, I was able to make so many partnerships, collaboration partnerships with other organizations within our community. And I started reaching out to like court referral office,
yep.
Our judges, pardons and parole, the sheriff's department, outpatient centers, the other CRSS in the community. We would meet every month and have lunch and discuss needs, resources that we work for, what our organizations can do to help meet needs, what organizations we need to get involved to help us break barriers and things. So the one common thing that was always brought up is we needed a central hub.
Yeah.
For people to walk in and be connected with whatever resource that they need. If it's just to come in and hang out, just to be in a room of people like you, we wanted to see that happen in Walker County. So I started talking to partners, and our local court referral office said, I love that you want to do that, and we want to support you. We have a 2,000 square foot office space that's right next door to them.
Amazing.
That's not in use. The roof leaks really bad, and it needs fixed up, but you're more than welcome to use it for rent-free. All you have to do is pay the power bill. And I was like, oh my gosh,
here we
go. This is amazing. This is amazing. And I went home and I spoke to my husband about it, and he was like, you need to do it.
Let's go.
You need to do it. And I wound up having to watch YouTube videos on how to patch a roof. And
no way, you did it?
I did.
Whoa.
I did. I spent the first 2 weeks patching the whole side of the building's roof. So everything that I done, I learned how to do through
on YouTube. Oh my God. Does that include like founding a nonprofit?
Mm-hmm. Yeah, so I
love it. I love it so much.
I took a class, like an online course for nonprofit, and I've learned a little through that, but not to the extent of what I was able to learn on YouTube.
Yeah.
And I knew I needed a board of directors. And
oh, I know.
And,
right.
It needed to be people, for me, it was important for them to be in recovery, because that way the mission never gets
interesting.
Lost,
So is 100% of your board in recovery?
Right now, yes.
No way. Wow.
When we first started, we had a lawyer that was on the board, but
which is helpful.
100%. But her mother was in recovery, so
they're connected to the mission.
Yes, 100%. And then we had a police officer, which was also on the board, but he had helped just as many people as I had get into treatment. And but now, so it was over half of the board to begin with. And now the whole board is
Wow.
people in recovery.
So let's say that I'm a person in recovery, and let's say that I just left the court building for whatever, you name it, for whatever, and I stumble into the recovery den. What kind of services am I going to find? What's it going to look like? Like, paint a picture for me, and then I want you to talk about some of the things that you do there, because I know that, you know, you really go hard for Recovery Month. Like I said, we have Smart Recovery there once a month. So I walk in, what do I see? What do I feel? What do I smell? Like, you know what I mean? Like, paint the picture.
You walk in, there's a little foyer area with resources, you know, but you walk in and you feel like you're at home. It does not feel like a doctor's office or like some
You're not going through a
uppity-up
metal
professional.
detector.
Yeah,
and
nothing
it's
like
not,
that.
Okay.
You're greeted by a peer mentor, you know, at the front desk. They'll ask you what services that you're needing, and Recovery Resource Center comes and does assessments at the Recovery Den on Wednesdays and Thursdays.
Awesome.
So if they're needing to get into treatment, we're gonna do an intake on them, and then we're gonna bring Recovery Resource Center into the mix and explain to them what's going on. They can come in, get clothing, toiletries, bedding if it's needed. We make sure that all the clothing that we have are really nice clothes. We
Yeah.
want people to feel comfortable when they go to treatment, but also when they get a job, we want them to be able to have nice clothing to wear. We are desperate need for men's clothes right now.
Okay.
but
Good to know.
But still, we
Gently used, nicer men's clothes.
100%.
Got it.
Yes. And we try to make sure that everyone that comes in also gets a kit of Narcan.
Awesome.
Two to be exact, because you know these days
Yeah. It's going to probably take more than one.
yes. And
How about like job, like help? Can I use a computer
Yes,
if I
we
need to
have
fill
a
out for
computer
a
lab.
job? Okay.
what we call a computer lab. It's two desktop computers.
Hey, that's
that
a computer lab.
we have someone that can help. You know, if you need help doing a resume or
Oh,
getting
love it.
online
Okay.
and looking up jobs and things like that. We're actually in the process of planning a workforce development program that we want to see hopefully in the very near future.
Awesome.
But
Awesome.
we want to make sure that not only do we connect with them and know that we're here to support them, we don't just refer them places.
Yeah.
We're going to make sure that the contact is made, and we transport also.
Wow.
So if they don't have transportation, we won't transport, 5-6 hours away.
Of course.
I put a limit on that just because I have been that person that had to transport for 5 hours away, and it sometimes can become toxic to the soul to be in a vehicle for so long, day after day. So we will help transport. We want to help people get to their court dates. We want to help people,
Get their
find
IDs
jobs.
and
Yes,
find
get
yes,
their
all that.
identification, whatever.
Like, you're really wrapping your arms around that person.
Right.
Yeah.
And we don't put a time limit on how long we're going to be there to support them. Like, we are going to be there from beginning until the day they say, I don't think I need support anymore, but I've never really had that happen. Some of the first people I ever helped was with being a peer. They are still very much in contact with me today. So,
I've heard it's sort of a family-friendly place as well,
yes. So
particularly around the holidays.
yes, family's huge. We work very hard to become the parents that, our kids deserved. We a lot of us lose our children. A lot of us don't have relationships with our families. You know, a lot of us don't. So we need to work on that. So we want to make sure that we include family in everything,
Absolutely.
except for services, because we are not going to turn anyone away who comes in seeking services. And sometimes children aren't, it's not appropriate
Of
for
course.
children. So like when we do Recovery Cafe, which we started the first Recovery Cafe that is a part of the Recovery Cafe network in the state of Alabama.
Woohoo!
So it is one of our most successful from the jump programs that we've done. And so when we do that, it's adult only, and we go into the Walker County Sheriff's Office twice a week. We do women's one day, and we do men's the other, and we take cafe, and then we do a recovery circle, it's a support group, and
literally people are just drinking coffee, talking about recovery,
and eating a meal.
and
Yes.
eating a meal.
Yes, and we all eat. We all sit down and eat together.
And it's the first and only in Alabama.
No, second.
Second.
I'm first.
You're
We're
the
the first
first.
in Alabama. There's another
There's
one.
another one.
Yes.
Okay.
Yes.
Trailblazer.
Yeah. So, but I love the cafe because there's not a single person that has come in. When people get out of the sheriff's office or leave jail, we're the first stop.
Which is amazing.
You know, they come and they're still connected, and I love that. We're making a difference, you know, and being able to support them longer, not just while they're incarcerated, but afterwards as well.
Right.
So that has been probably one of my most favorite things that we've done, just because it is like family.
Yeah.
So
That's incredible. So what can people, I mean, you're doing the work 365, but you particularly ramp up for Overdose Awareness Day and in September, which is Recovery Month. So hopefully people come and check you out beforehand, but if they're going to come in September, what are they going to see?
So we have two big events. We do the Overdose Awareness Walk, which is August 31st at the end of the month. We always do it downtown. You know, we have resources set up. We have people come and speak, and we do a walk downtown Jasper. And this year, we have a yearly event called Soberfest, and this year we're doing it at Walker County Lake, and the theme this year is Recovery Roundup, so it's like a little Western theme.
Oh, I love that.
And we're going to have like a mechanical bull, and it's out by the lake. You can fish. You can bring your fishing rods and fish. If you don't have a fishing license, they can give them to you there. And
Very cool.
It's gonna be a lot of fun. So
And
that's
really
gonna be
just
September.
a time to celebrate recovery. You don't have to be in recovery to go, meaning like you could be like a friend or a family.
Yes.
And it's like just fun.
Yes.
Right? Like it's a
Yes.
celebration.
It's a celebration. We wanted to do something to where we honor people that we've lost, but we wanted to make Recovery Month about celebrating
Yeah.
what is possible and what we are seeing in Walker County. You know, because our favorite thing to say is Walker County can recover, and Walker County is recovering. So
I feel like you just gave Ronnie the title for the podcast.
we are we're making a big difference. You know,
You're making a huge difference.
our judge that sees 90% of all, you know, like drug related cases is our number one supporter. I mean, he has sent one of the girls that is employed at the recovery den to prison several times, and he is so proud of her. You know, he has sent me to jail many of times, and he is so proud of me. You know, he is so proud of all of us. So he is probably, I would like to say that he's one of our top supporters, vocally, you know, and that means a lot coming from where he has been the one to put us in jail and see us at our lowest low and then see the difference that we're able to make in the community.
Yeah. How proud are you of you?
Extremely, extremely proud. I know without my recovery, I have nothing. So recovery has to come first. And today I'm a good wife, I'm a good mother, and I'm a good friend. You know, I don't like to be looked at like I'm their boss at work. We are a family, and I'm your equal. And we have the absolute best crew. I mean, it is like a literal family when you walk in the door. And I think that makes the biggest difference for when we encounter people because of how much we care for each other.
They can like feel it. They can feel the trust and the relationship and the connection.
Yes, yes. And have people walk in that I used to use with, that any of us used to use with, you know, or known what we have, you know, done and been in trouble for and things like that, to see where we are, you know, they're like, if you can do it, I can do it. So I want everybody to know, no matter what the circumstance is, if you want it, it's there. All you got to do is reach out. We're here to help. And I think that we're making huge strides in Walker County, helping people.
You're doing it. You're doing it. Thank you so much for being here.
Thank you for having me.
Really appreciate all of the support we've gotten from you, the partnership, the connection. You're doing amazing things.
Thank you.
So thank you. If you like what you heard, and I know you did, please consider rating, reviewing, and subscribing to The Shield.